Hello everyone. The topic we are going to discuss today is breast cancer. So here are our main learning objectives about breast cancer. What is breast cancer? What is the structure of breast? What are the signs of breast cancer? What are the types of breast cancer? What are the main causing factors or risk factors that can lead a person to develop breast cancer? How screening of a breast cancer can be done in a patient, how to diagnose the breast cancer, and what is the treatment plan patient having breast cancer. First, we will start from what is breast cancer. Breast cancer is a disease in which breasts grow out of control. So there will be an uncontrolled growth of cells or tissue in breast that can develop into a tumor, and ultimately that tumor will develop into a breast cancer. It is the second most common cancer among the women. It can begin in different parts of the breast. So in this pic you can see that only one breast is affected, but both can be affected at a time. So now we will see about the structure of breast. A breast is usually made up of three main parts. These are, first one is lobules, other one is ducts, the third one is connective tissue. What are the main functions of these three parts? Lobules are the glands that produce milk in the breast. Ducts carry this milk to the nipple, and the connective tissue present in the structure of breast surrounds and holds everything together. Now, the signs and symptoms that are present in a patient. In its early stages, it may be symptomless, but a tumor may also be present, but that will be too small to be felt in its early stages. Then it can develop into a breast lump or tissue thickening in or around the breast. Patient will be having breast pain, red or discolored pitted skin, swelling in all or part of the breast, a nipple discharge other than the breast milk. Inverted nipple is also a sign of breast cancer. And the last one is change to appearance of skin on breast. It usually red in color, and there will be irritation or allergy type reaction present over that area where tumor is developing. Now we will start from the types of breast cancer. There are usually two main categories of breast cancer. The first one is invasive and the second one is non-invasive. Non-invasive type of breast cancer is also called as breast cancer in situ. Invasive spreads from the breast ducts or glands to other parts of the breast. So in invasive type of breast cancer, the other parts or glands of a breast can also be affected. Non-invasive or breast cancer in situ doesn't arise from the original tissues of the breast, and it is the most common type of breast cancer. In non-invasive breast cancer, the tumors may develop from the other tissues of the breast, not from the lobules or ducts. So there is a ductal carcinoma in situ. DCIS is a non-invasive condition. Cancer cells are confined to the ducts in breast. Cancer cells do not invade the surrounding breast tissue. Lobular carcinoma in situ. This cancer grows in the milk producing glands of the breast. Like DCIS, it is non-invasive and doesn't invade the surrounding breast tissue. So there are some of breast cancers that are less common. These are Paget disease of the nipple. It begins in the ducts of nipple. After its growth begins to affect the skin It also affects the areola of nipple. So it also affects the nipple as well. What are the phyllodes tumor? These are very rare breast cancer, grows in the connective tissue. Most are benign, but some are cancerous as well. So stages of breast cancer is very important for the treatment of breast cancer. That what is the stage of or extent of the breast cancer, and then according to its stage the treatment plan is being done. So stage 0, in this case the breast cancer cells do not invade the surrounding areas. Ductal carcinoma in situ is stage 0 cancer. Then stage 1 breast cancer. Here are two main divisions. Stage 1A. In this case, primary tumor is 2 cm wide or less and lymph nodes are not affected. In stage 1B, the tumor size is 2 cm or less in size, but the lymph nodes are affected. In stage 2 cancer, there are two divisions, stage 2A and stage 2B. Stage 2A tumor is less than 2 cm but invades to 1 or 3 lymph nodes. It may be 2 to 5 cm in size and it don't metastasize if its size is 2 to 5 cm. Then stage 2B and then stage 2B tumor is 2 to 5 cm in size but has affected 1 to 3 axillary lymph nodes, may be larger than 5 cm in size. Stage 3 cancer. This is the very advanced stage of the breast cancer. The tumor is always greater than 5 cm in size. Tumor invades to 4 to 9 axillary lymph nodes on initial stages. Then later on it spreads to 10 axillary lymph nodes and collar bone as well. Stage 4 cancer. It spreads to different body organs and metastatic breast cancer is developed at stage 4 cancer. Now we will see the risk factors. The first risk factor is, and it is the most important, that a woman is being affected. 100 times more common in women as compared to men. Hyperfunction of estrogen and progesterone. Then aging risk increases the double after the age of 45. 10 to 5% cases are hereditary. Family history of breast cancer. Usually first relative is affected, then there are chances that a woman is also affected in that family. If one breast affect, most of the time second one is also affected. When we talk about the diagnosis, then there are following techniques. Mammogram, in this case this is the most common imaging test to see below the surface of the breast to check for any deformity or uh, other signs that are present in breast cancer leading to breast cancer. Most suitable to check for breast cancer for women of age 40. It can be done annually and it requires additional tests for confirmation as well. If we talk about ultrasound, then it uses sound waves to create a picture of the tissues deep in the breast, helps to distinguish between tumor, a solid mass or benign cyst. The last one is biopsy. This is very important and very helpful procedure. A tissue sample is removed from the suspicious area of the breast. A needle is used to remove that tissue. Then incision can also be done to remove a tissue. Then sample is sent for the final results from the lab. So what is the treatment plan? Treatment plan is surgery. Following procedures are done in surgery procedures. These are lumpectomy, mastectomy, sentinel node biopsy, axillary lymph node dissection. Then second one is radiation therapy and chemotherapy. What is lumpectomy? Remove the tumor and then rest of the breast remains intact. In mastectomy, entire breast is removed. In double mastectomy, both breasts are removed. Sentinel node biopsy. In this case, we remove the lymph nodes that drain the tumor. Lymph nodes are tested for the confirmation of breast cancer. And in axillary lymph node dissection, Auxiliary lymph nodes are usually removed to check for spread of the cancer. And in radiation therapy, high-powered radiation beams are used. They target and kill the cancer cells. External beam radiation can also be used to assist in radiation therapy. Surgeons place radioactive seeds or pellets near the tumor site and they destroy the cancer cells. Chemotherapy is also important. It's actually a drug treatment to destroy cancer cells. It is done with surgery treatment usually. Works by blocking hormones production. In chemotherapy, the drugs that are usually being used there stop the release of hormones estrogen and progesterone. They help to slow and possibly stop the growth of cancer cells. So, prevention is most important to avoid breast cancer. A woman should avoid obesity, a regular checkup for the breast at least 6 months, getting regular exercise, maintain a nutrient dense diet to keep yourself healthy, limit or avoid alcohol. I hope you like my video. If you really did, then kindly comment, share and subscribe my YouTube channel. Thank you very much.